Sway Health.
Andrew, welcome to the show. Thank you for being here with me today.
Thank you for having me, Brittany. So excited.
I think I told you this, but I've been looking forward to this interview for the last couple of weeks. I know we've had to reschedule a couple of times, so I am so glad we are here and ready to get into it.
Absolutely.
So, for those of you or those who are listening that don't know you, maybe you can tell our audience a little bit about who you are, what you do, and maybe a fun fact about you that people might not know.
Yeah, totally. So, my name is Andrew Thompson-Young. I am currently the Director of Public Relations at Clarity Quest. I would say that really I'm a healthcare PR storyteller. I have always been drawn to healthcare, and my husband could tell you I'm obsessed with PR and could talk about it all the time. I love, working with clients to get them the media, grow their thought leadership presence. That's really my passion when it comes to work. And I guess my fun fact would be I'm a huge fan of the Golden Girls. I have so many things that I've collected over the years. And when my husband and I moved to this house, we had some extra bedrooms and we were like, what are we going to do with them? So we actually put together a speakeasy in our house that is all Golden Girls themed. So anytime anybody comes over, that's like the first stop we take them to.
Amazing. So now I have to ask this question because my girlfriends and I, there's four of us, and we always call ourselves the Golden Girls. And one of us, matches the personality. Is there one that you would say, I am this Golden Girl?
Absolutely. I'm Dorothy through and through. I
Me
love the
too.
sarcasm, the dry humor. Absolutely. Everybody who knows me would say that I'm a Dorothy for sure.
Oh my gosh, we are going to get along great because I am a Dorothy too. I love that. So
I love
good.
it.
Oh,
How could you not be?
right. She's the best one. She
Oh,
is the
yeah.
best one.
Impeccable.
Okay, so you joined Clarity Quest in 2023 after being a corporate sports spokesperson for senior living. Can you tell us a little bit, about that journey and your past role and kind of the journey into your new role?
Yeah, absolutely. So from the start of my career, like I knew PR was obviously what I wanted to do. I didn't originally think healthcare. I was just kind of trying a bunch of different things when I was in college and interned at a bunch of different companies. And I ended up at a healthcare agency and was like, oh my God, I absolutely love this. Like, this is what I want to do. I love how at healthcare, it's all about the human. It all has to zoom down everything you're doing. If you're talking about the revenue cycle, if you're talking about medical devices or, pharma developments, like it all connects down to helping people. And just, I like to think that it kind of gives me the warm and fuzzies that, I'm playing a part in that. And I've really enjoyed my work over the years. And, having had the opportunities to work in-house as a corporate spokesperson was really amazing because, especially as an agency person, it shows me what my clients need. It lets me know, what are those internal meetings that are happening that you're not a part of? What are the right questions to be asking? And, what are the pressures on the other side? So, being in an agency is definitely somewhere I feel very comfortable. I love it. It keeps me busy. And I'm always, jumping from different verticals. So I get to learn a little bit more about healthcare. Some days I think I'm a radiologist because, that happens to be what I'm focused on that day. And I just get so enthralled in my work that I'm just I dig in, I get so excited, getting to talk to these leading experts in these fields. Like it's just a cool opportunity. And then to get to share that story with audiences is something that I love about my job.
Cool, because it's almost like being an actor too, right? You can different things that you're focusing on, you can kind of play that role and then put it out to a bigger audience, right?
Yeah, absolutely. Like, it's like, how do I get passionate about this subject? Because passion really sells these things. You have to have that
Hmm.
story, you have to have that hook. Why does someone care? A lot of times, people think they have news, but it's just news to their company. It's not something that
Right.
others want to read. And I'm just like, what would John Smith, in Ohio, why would they want to read this story about your company? Why do they care? And of course, when you're going to trades, you have to think about who are all of the intended audiences? Who are those secondary audiences that we may not be thinking about that we're reaching out to, making sure it's all succinct. It's really just a really fun opportunity.
I love that. And you talk about passions, and in your nominations for the award that we'll talk about a little bit later, you've led some really impressive PR campaigns in areas like rebel cycle management, AI, biotherapies. What has been the most rewarding campaign or project that you've worked on, and what have you been most passionate about?
Well, I would say the thing that I'm most passionate about, this month, it really changes on the daily sometimes, but October is Breast Cancer Awareness Month, and this is something that I've been very passionate about for a while. I've had multiple radiology clients over the year, so I've learned a lot about, mammography specifically for Breast Cancer Awareness Month, and I actually had a really interesting story where I was reading all this stuff, reading the studies, working out with a client, and I was just like, "Oh my gosh, I need to call my mom and be like, you need to be going to get your regular checkups, like, go do that." So thankfully, I was able to inspire her to go to the hospital, go to her doctor's appointment, get her screenings that she needed, and they actually ended up detecting a lump. And thankfully, it turned out to be non-cancerous, which was, such a blessing. But it was crazy to have like my work that I do. Like you said, sometimes revenue cycle, it's AI, sometimes it's radiology. It just depends. But it was so cool to like actually get to like bring that home, and it was almost like a proof of concept of what we were trying to do. And we were trying to get audiences and women to make sure they're doing their regular screenings, make sure they're following the guidelines. There have been a lot of changes, so I think that's something that I'm just really passionate about. My family, I have a cancer that runs through it, so it was just something that like it really hit home for me. It was a great way for me to connect with the story, and ultimately I was just like, wow, this is amazing, like I love this work, and you don't get those opportunities all the time for it to kind of come home with you.
Mm-hmm.
So that was something that I think I really loved, and everyone out there needs to make sure they're doing their proper annual screenings. It's so important to stay aware of your health and getting ahead of it as best you can.
I couldn't agree more. And I love that you mentioned that because it is such I think a big part of, everyone's life, maybe not breast cancer in general, but, cancer in general. So to make sure that everybody's getting those screenings is super important.
Absolutely, everybody in the
Um,
nation is impacted by cancer in some way. Absolutely.
for sure. And, we kind of talk about those most important campaigns, but I want to kind of talk about pitches for a little bit. So we're kind of full swing into the fall conference season. Events are taking place, conferences are taking place, and us as a media company, we get a lot of media pitches, on the daily. And you've secured media placements in outlets like BC Advantage and The Medicine Maker. So I'd love for you to talk a little bit about how you approach crafting a winning media pitch.
Absolutely. Well, it's definitely a very competitive environment when you realize how stretched reporters are across every industry, from the New York Times to Modern Healthcare to Moby Health News. Like those reporters are putting out so much great content. They're really busy, and it's how do you be the best asset for them? How are you making their job as easy as possible by being reliable? Are you showing up on time? Do you actually have news? Something I tell a lot of my early clients when we first engage together is everybody wants to be a thought leader. That's always what you want to hear. I want to be a thought leader. But in order to be a thought leader, you have to be a thought haver, which is, I know it's kind of a funny statement there, but you have to kind of have those opinions early on. A lot of times, especially in healthcare, we'll see people who like to wait until there's more information and, oh, well, I don't want to say anything just yet because things might change. And that's sort of the risk you take when, a controlled risk, of course, when you're making these statements is how do you speak on behalf of the industry? How do you provide a voice, a thought, an insight that is exciting and interesting and new? Why,
Mm,
I went back to my earlier statement. Why is someone wanting to read this? Why is this a thought provoking thing to say? you don't want to just use corporate jargon, you don't want to sound like your terms and conditions that nobody reads. You want to sound exciting. And I think working with clients to one, understand that first. And then once they understand it, you can just see it kind of clicks in their head. And then they kind of have a better understanding of, okay, well, here are the kind of stories we're looking for. Depending on their vertical, it might be patient stories, it might be clinician stories about how they're improving workflows or something like that. But knowing what people want to read and also knowing what's going on in the news, this year, security has definitely
Mm,
been a hot topic. And, while I personally was even impacted by the Change Healthcare when I got the notice, saying that my information had been leaked. And I think that was probably like the eighth cyber attack I've been involved in this year. I should have the identity monitoring for the rest of my life at this point with all the free notices I get in the mail. But using something like that to say, how do we speak to security when it's on everybody's mind? Every health system and hospital is looking to be as secure as possible with this incredibly valuable data from their patients, and they want to, uphold that security. So how do we play into that? How do we talk about, how are you leading security for your industry? Why is this so important? What can people do? What are actual tactics that people can use? It doesn't have to be super complex. And, in the Change Healthcare, it was that two-factor authentication that wasn't there. So it goes to show
mhm.
you can have the most impressive systems, but, even things as simple as that can be missed and have catastrophic effects. I think it was Benjamin Franklin that said, a reputation is built on many good deeds, but it can crumble with just one misstep.
Mm,
So I think
mhm.
that's something I try to guide my clients with, because if that was true when they were riding around a horse and buggy and candles, it's still very
So
true
sure.
today in the world of social media and, your online presence. So it just kind of, some things are tried and true. And I think that's one of them.
No, for sure. Well, those are some great tips, and I agree. Sometimes, things that worked, hundreds of years ago, still, like you said, stay true today. So sometimes we just have to kind of implement those and, make sure we're hitting the mark there. And we talk about the industry as a whole, and whether it's security or revenue cycle management. You know, Healthcare is a fast evolving industry, as is PR. Um, how do you yourself stay ahead of the trends to make sure, that your clients are remaining competitive and doing the things that they need to do to get their kind of brand out there and their message out there?
Yeah, it's definitely something you have to be on all the time. Literally being out of the news cycle for a week can mean that you've missed something really pivotal that your clients could be a part of. For me, I love reading the news. I think I've always just been like a child of the media. Even just in my personal life, like I love reading pop culture news and,
Mm,
just some of the celebrity gossip sites. Like I love that. And I think that goes over to my professional life as well, because I love seeing what companies are doing. What are they up to? As a person who uses the healthcare system myself, like I'm interested in just how things are developing. We've had a lot of really interesting headlines recently around things like retail health and how
mm,
that has just evolved, and how, everyone was really hedging a lot of bets on that and it didn't end up panning out,
mm,
surprisingly and unsurprisingly to some people. But I think it's just always reading, always engaging, not just being someone who thinks they know what's going on, but like actually has the evidence to back it up. Here's why we want to pursue this, subject. And a lot of times it means zooming out with clients, because sometimes they just get so focused on what they do and they just want to tell that one story. But you can
mhm,
tell one story a dozen different ways by just kind of like splicing and dicing it down
mm,
to specific verticals, specific stories, and just always keeping up with what is the hot thing at the moment. What are people interested in?
mm,
Where are people going for their news? Something I love to ask my clients is where are you going for your news, making sure that as we look to go and meet these audiences where they are, we need to be staying ahead of that. I am always scrolling through LinkedIn to see where are people sharing articles from. How are they doing? Are people really liking a lot of those articles? That lets me know that that audience is really interested in that particular publication. So it's a lot of work, but when you just enjoy reading the news and building those connections, I think it comes easy. I've always loved the definition of public relations being building mutually beneficial relationships,
Mm,
because it should work both ways. You should give something. You should always give more than you receive, just as I think a general point. But if you follow that in any relationship, I think you're going to see the return is always going to be tenfold, just because when you're doing something without expecting to getting something back, it's
mm,
really unique in today's world, I think, especially.
mm,
So I think that's just my general approach, is how do I stay on top of everything, and how do I be an asset that reporters and journalists, know and want to connect with.
mm. And I think that's a great lens too, like you said, taking a step back and, you don't always just have to tell your story one way. So, how can we take a step back and look at it holistically and maybe tell it in a few different ways and in a few different places?
Yeah, and you never know where that story is going to take you either.
For sure. So I want to talk about this little pink thing in your background here a little bit.
Of course. Do you mean my
Oh,
Sway Rising Star
I
Award? Oh my
love it.
gosh, how'd that get here?
Not planned, not planned. So you were the 2024 winner for Marketing Rising Star at an agency. Congratulations again.
Thank you so much.
So you have a pretty, unique skill set and perspective. So I would love to know, what specific skill set and perspective do you think, helps you not only lead your client accounts, which I think you do so well, but also in turn, got you nominated to win this award.
Well, I want to thank my manager, Josie, for nominating me. I thought that was incredibly kind, and a great way to kick off my first Sway event. It's been nice to engage with the community, virtually, and it was so great to get to come together, put faces to names. And I think for my work specifically, I look at public relations under the marketing umbrella, and how that connects. So I would say writing is the biggest thing. I spend 90 to 95% of my time writing. Some days it's just writing emails, some days it's press releases, bylines. Writing was not something that I actually enjoyed prior to college, but I had a really amazing professor who got me to just really fall in love with writing, and taught me the rules of the road. And from there it just was skyrocketing, with how my passion grew in it. So writing is definitely a big thing, knowing AP style through and through. You'll never see an Oxford comma on anything that I'm submitting. And it's something I love to have conversations with clients about, because everyone does it differently. And have being able to build connections with people. We're in a very virtual world. It's not every day that I get the opportunity to connect in person with reporters. So knowing how to do that virtually, I think, especially in this modern world, you just have to be able to put some of yourself in your communications, and you want to be more than more of the same, I think, in order to stand out. And just making sure that you're always trying to tell the best story possible, following your morals and your ethics very clearly. Always something I find really important. But writing is always going to be the one thing in PR. And knowing what's going on in the world, you'd be surprised how you can pick up different tips from different industries, that you wouldn't necessarily think about. Healthcare is very specific, and I always tell people, anybody could sell a doorknob, not anybody could sell healthcare. So you
Mm,
really need to be on top of it. You need to understand how the healthcare system works. It's very complex, and you don't have to be an expert in it, but you definitely need to understand the basics, understand how things get paid for, understand, what are the real struggles. Everybody likes to chalk it up to healthcare being, this really expensive and inefficient thing, but it's something that people are working to improve, and everybody wants it to be this ideal system. And I like to think that, every day we're hopefully getting one step closer to that. So just, being on top of it is definitely a big thing in healthcare.
Well, and I think we also have to say well, from my point of view, you also have a great aura and vibe and personality. So that probably chunks up to being such a great way of connecting with your clients and why everybody, you know, wanted to nominate you and why you won that award. So
Thank you. The
congratulations on that.
flattery will get you everywhere with me.
So was this your first Sway Health conference that you went to?
It was indeed, and a memorable one to say the least. I'm looking forward to the next one. I don't remember if I don't know if you remember, but I walked into like the first mixer for first time participants, immediately spilled coffee down my shirt, and I was like, all right, well, I got this low point out of the way. It's all up from here.
Oh,
But it was super great. Got to connect with clients in person, some prospective clients that we've, engaged with now. And just loved it. It was a great, great time. Always fun to connect with my colleagues in person as well.
I love that story because I have a similar story. We were in Atlanta for my first one, and I had my backpack on, and I was super eager. And it was these long tables that had chairs behind them with these big water jugs. And so I tried to like scoot in, and then someone caught my eye, and I turned, and my backpack knocked over all the water jugs, all over people's laptops, all over the place.
Oh my
It was
God.
memorable, and just like you can only go up from here.
Yeah. Something about Atlanta. I don't know.
Oh, well, exactly. Crazy.
Mm.
So how did you feel when you found out that you won? I remember seeing you in the audience when your name was called, but I always love asking people how they felt when they found out that they won.
Elated to say the least. Obviously, it was such an honor, and it's also just like so nice to know that I being recognized by the organization, by everybody, knowing that my boss submitted me for it. It's just something that like I don't take lightly. I think it was just something that I will not forget. The award definitely sits on my desk sometimes with clients. Just gotta move it into the window a little bit more. But it's definitely been an amazing thing. I love the community, and have really just grown my network and learned more about different areas of healthcare. So I've loved it and would highly recommend everybody take the trip to the next Sway Health Live.
Awesome. That's so great. I want to talk a little bit about inspiration. So, one of the things that caught my eye in your nomination was you named your dogs Naomi and Gianni after what I assume is iconic fashion figures.
That is
Um,
exactly right.
yeah. Does fashion and pop culture inspire your PR approach or creative in any way?
Yeah, absolutely. One, they were just the names that like embodied them completely.
Mm.
They're actually right here at my feet right now. I'm surprised you can hear them snoring. That's what I do all day while I'm working, is just the dogs lightly snoring in the background. But I've definitely always loved fashion and just the fashion industry generally. I think it is a really, especially as from a PR perspective, they're always trying new things. It's very cutting edge, new ideas, new launches. And I think that when you're trying to keep up in this industry and really any industry, you need to be seeing what others are doing. There are things that will work in different industries that can work in yours if something does really well. Um, and I think that is what I get from fashion. Also, just my personal life, love to dress up. Clothes are so fun. It's a great way
Mhm.
to communicate, who you are and what you're about. Although my clients, this is usually what they see. My uniform is my white button down, so
Mhm.
they don't always get to see, the fashionable side, but Naomi and Gianni are always very close by.
I love that. I'll have to do some Googling on your Instagram to see some of the fashion pics that you chose because I'm sure they're amazing.
Oh yeah, absolutely. There's one photo that like from our wedding that we always have with the dogs, and I'll have to send it to you after the interview
Yes,
because it's a very quintessential piece.
love it. Okay, so looking forward, what do you hope to achieve in the next few years in your career or in, the PR field? Any kind of big dream clients or campaigns that you'd love to work on?
I am always one for a plan. I
Mhm.
followed a very strict 5-year plan and, was able to accomplish the things that were on that list. And I've always think that in order to get somewhere, you need to know where you want to go. So I think as I continue to grow, I know that PR will be my home for my career just because I'm so passionate about it. It's something I really enjoy, and that's what I really need out of my work. I think, of course, I love working with tech companies. I love things that have the impact on the human level. I love complex processes. I love taking things that are hard to digest and simplifying them. I think that's how I understand things. I think it's how a lot of people understand things is like, how can you make this simple? How can you make this understandable? In healthcare, you really need that. So, I would love to continue, I love B2B communications. I think it's really where a lot of healthcare gets done. So I think that's something I'll continue to do. And I love working with executives individually, building up their thought leadership presence, connecting it to their business and their bottom line. PR is not something that you just can do without results. You need to be able to drive it to the bottom line. What are those analytics that you can provide? And I think especially in the years ahead, we're going to continue to see AI and the Chat GPT effect continue to have an impact on the industry. I think there's going to be more of a priority on the actual human connection to it. People are very quickly seeing through, when people write something 100% with Chat GPT. I know anytime when I see like the complex dynamic healthcare ecosystem, I'm like, well, I know who wrote this immediately. So I think, figuring out how to use AI in a way that makes us better, but not relying on it 100%, is something that'll be a big focus in the years ahead. So yeah, for me, I know I'll still be in healthcare doing PR, but just continue working with amazing clients who are making a difference every day.
Well, Andrew, I know that we will continue to watch you, and I'm sure your career is just going to go up, up, up from here. So, on behalf of the Sway community, we're so happy to have you in the community, and love that we've been able to, connect with you over the last couple of years. So, happy to have you as part of the family.
Thank you so much. Love being a part of it.
Well, this kind of ends our time for today. I wish we had longer. I'm sure we could probably talk for hours and see the similarities we have in our lives other than Dorothy. But we will call it for today. Andrew, thank you for being here with us today.
Thank you, Brittany.